Most of us have been there. You bend over to pick up a pencil or twist the wrong way and zap, your back goes out. It's miserable, it's frustrating, it's usually the first thing you think about when you wake up. But 80% of people will experience back pain, and for the vast majority, it's just a muscle strain that will heal with time. Hi, I'm Dr. Jayesh Bhanushali. As a spine surgeon, there is a small percentage of patients I see where waiting it out is the worst thing they could do. Now, how do you know if your back pain is just an annoyance or a medical emergency that requires surgery tonight? If you ignore the wrong symptoms, you aren't just looking at a long recovery, you could be looking at a permanent nerve damage, paralysis, or loss of basic bodily functions. These are what we call the red flags. Here are the top 5 signs that your back pain is actually an emergency. If you feel numbness or pins and needles in the areas like your groin, buttocks, and inner thighs, that is a massive red flag for quad-equina syndrome. Second, if you lose bowel or bladder control, if you suddenly can't go to the bathroom, or more commonly, if you find you're having accidents and can't feel it happening, your nerves are under extreme pressure. Third, if you have sudden leg weakness, I'm not talking about how it hurts to walk, I mean your foot is dragging or your knee buckles when you try to stand, we call this a foot drop, and it means a nerve is being crushed. Fourth, if you have night pain and unexplained weight loss, if your pain is worse when you're lying flat at 2 am and you have lost significant amount of weight without trying to lose it, we need to rule out an infection or tumors. If you've had a fall and you are over 65 or have thinning bones, a sudden sharp pain could mean a spinal fracture. If you checked yes to any of those, stop this video and head to the emergency room. Timely intervention, often a surgery within 24 to 48 hours, can be the difference between a full recovery and a permanent disability. But for everyone else, if your pain is just local to your back, even if it's intense, the solution is usually much simpler. Gentle movement, don't stay in bed, anti-inflammatories, physical therapy, carefully listen to your body. If it's just pain, we can manage it. But if it's numbness, weakness, or loss of control, that's your spine's emergency signal. Stay safe, move often, don't ignore the red flags, and I'll see you in the next video.